It's great to have you on TVC Breakfast. Let's get on with the show now. According to the World Health Organization, more than 17 million people die from heart disease worldwide every year. More than 80% of these deaths occur in low and middle income developing countries. Today is World Heart Day, and the goal is to raise awareness on cardiovascular diseases, heart disease and stroke. This year's theme, Use Heart to Connect, highlights the power of digital health to improve awareness, management and prevention of cardiovascular diseases. Globally, and it focuses on the immediate requirement to find innovative methods of connecting people to educate them about heart health, especially in areas with insufficient resources. So, Director Interventional Cardiology, Evercare Hospital, Lagos, Dr. Jagan Hanumanthu is here with me this morning. Jagan, it's good to see you.
Nice meeting you. Good morning to you.
Good morning. You're welcome. Great. Now, let's start it this way. Just when we talk about cardiovascular diseases, we often hear these things, but what really constitutes the diseases that are classified as cardiovascular diseases?
Well, it's a very good question to say that. And cardiovascular diseases, every organ which is connected with a blood vessel is related to the cardiovascular disease. But we give special importance to the heart and brain and the legs and kidneys in general. So whenever these organs are affected because of the blood vessels are diseased and the blood flow is decreased, and they give symptoms either sudden onset or it is a slow onset. So the sudden onset becomes a catastrophic and fatal sometimes before the patient realizes or reaches the hospital. So the second point is the disease, when it affects, it is always a silent disease. It doesn't show any symptoms in the beginning, and slowly it increases, and when it reaches the severe levels, then it is too late to take action. So I say the cardiovascular diseases are a global pandemic, but it is a silent pandemic. Unlike COVID, it is we know that it is there for the last 2 years, and it can be cured with the 2 vaccinations or 3 vaccinations. But global cardiovascular diseases do not have a quick fix like that. It has to be slow and continuous and determined effort to control the problem.
So let's narrow it down to the heart. What are the things that we do on a daily basis? Because I like to start from there where people can connect to some of these things. What are the things we do on a daily basis that can pose a threat to the heart?
Well, to start with the getting up in the morning, the first thing people light a cigarette. So smoking, that is number one, which is very detrimental to the heart. The second is they resort to immediate work or something which they don't do any physical exercise. So the sedentary habits is the second part. The third is the diet. The diet, if it is neglected food intake like extra fats and extra calories, which increases their cholesterol levels and the body weights, and finally leads to the blockage of the blood vessels. And these are the 3 main things in the beginning of the day. When a person gets up from bed, he should always chart out his morning schedule, like some physical exercise and a good healthy diet, and go to the office in time, and then spend evening when he comes back, spend some quality time with his family and friends. I mean quality time. It doesn't mean that you should sit in front of a TV and watch a movie together with your family with a soft drink and some snacks and all. That is not the one. I say that go out and spend time with the children in the playground or a picnic spot, any weekends. So that is constitutes a good quality time. And once that is done, awareness is important, and awareness comes from right from parent, mother to son and child, from the schools, from colleagues and peers. All this, the indirect health education is important for every family members.
All right, I am interested in the issue of diet. You mentioned diet earlier on as to what we eat and what should we eat, what should we not eat, or at what time should we eat what, and what time should we not eat what. You know, all of those things. Because the point there is, on a daily basis, Nigerians are, especially in Lagos, everybody's hustling, everybody's working, everybody. So sometimes there is no routine as to what time should I eat. The breakfast, lunch, and dinner is not there. Just go grab anything and eat, and then and then you continue. But talk to us from that window, really. When you talk about diet, break it down for us to understand the nutrition. What should we eat? What should we not eat? What time should we eat, and what time should we not eat?
The diet is always constitutes of timely meals, number one. If you skip your meal in the either breakfast or a lunch, if you don't take it in time, that constitutes bad on your gastrointestinal system as well as your performance of your work and other things in long run. So I say that once you follow the routine timings of your meal and the morning breakfast, you should always have in time rather than skipping a meal is always bad. I say that the breakfast should constitute enough proteins and enough carbohydrates and vitamins and some nutrients should be included in the breakfast, and the lunch is always it should not be omitted or it should not be delayed, but you should always keep some vegetables in your diet as a part, and the fruit always constitutes a very healthy and option for anybody. It is reachable and it is affordable, and it can be digested easily for all age groups. The third is that the food what you should avoid is high quantities. I will not say that you should avoid totally. The excess amounts of red meat or fats like cheese and fats should be avoided. You can take it in moderation, once in a week or twice in a week you can take it, but you should always remember the fat is the cornerstone of the heart diseases.
All right, we have often heard people have, on daily basis, people talk about heart failure or heart attack and things like that. What really leads to a situation like that?
Yeah.
Can you break it down for us?
I'll just tell you. Heart attack is a sudden and heart failure is a slow thing to happen. Heart attack, when the blood supply to a part of the muscle of the heart is blocked because the vessel is choked with cholesterol plaque and it doesn't allow the blood to go, and that particular part of the muscle of the heart dies, and when it dies it causes pain, and once it dies it becomes futile. It becomes weak heart in that spot, and repeated attacks of similar nature make the heart weaker and weaker and all like. So then the heart failure is something which happens over a period of time, like the conditions which lead to heart failure when the heart works excess load, like high blood pressure, or when there is extra load is given for the heart manual work, and if the person is not taking enough rest, the heart muscle sags and slowly it enlarges, and the heart muscle enlarges and the heart dilates, and then it becomes the function deteriorates and leads to heart failure. And heart failure is something, is a irreversible condition to some extent unless it is diagnosed in the early stages, and heart failure is sinister than a cancer. Cancer kills 2 to 5 years, and early detection of cancer can be treated and cured in some cases, but heart failure, if it is detected late, death is always certain, and 2 to 5 years is too long. Sometimes people die within 2 years or within 1 year, and the repeated admissions in the hospital, and that is very expensive and costly and difficult to sustain life in that age. And the heart transplantation is the only answer for the heart failure, which is not easily done, available in all places, and it is the donor and other problems are there with them. So with all that put together, heart failure is a slow condition which makes the heart weaker and weaker, and the heart says that I cannot pump anymore, I cannot beat anymore. And the heart attack is a sudden healthy heart suddenly becomes weak, or part of the muscle dies, and that causes a sudden pain, and that leads to heart attack. And the reason for the heart attack is blockage of the arteries, whereas the reason for the heart failure is excess load for a long time, like high blood pressure, which is not taken medicines, and the people land up in problems.
How about stroke? How is stroke connected to the heart, or is it not connected?
The stroke is something, the brain has got 4 blood vessels supplying to the heart, from the heart, and those 4 blood vessels are supplying both sides of the parts of the left and right hemispheres of the brain, where the blockage of any of these blood vessels causes the death of the brain tissue, and that is called stroke. And this blockage can be in 3 forms: either it is by thrombus or a clot, or it's some embolus clot is coming from the different part of the body, or it can be rupture of the blood vessel which is causing a hemorrhage. And all the 3 conditions cause very sinister situation, like a patient will go into coma or sometimes irreversible paralysis. If it is diagnosed very early, thrombosis can be given thrombolysis and treat within 1 to 4 hours, but beyond that the heart brain sustains irreversible damage and the patient lands up in a paralysis. And the stroke is a very sinister thought to a patient, because it takes away his life and his livelihood and makes him a dependent in the family.
All right, people who have diabetes or high blood pressure, how vulnerable are they? Or I'm trying to connect it to the heart, the diseases in that situation. How vulnerable are they to?
As I said, only the smoking and eating and cholesterol, these causes the heart attack. The other parallel diseases like high blood pressure and diabetes, like diabetes mellitus, which are the chronic conditions which are rampant in the population, in the public, whether it is a poor country or developing country or developed countries, all of them are being affected by these 2 diseases. And it slowly, again, these are the silent diseases, silent disorders. They don't show any manifestation in the beginning, and the patient doesn't take adequate medicines. They affect the blood vessels, and they become, again, the atherosclerosis or plaques of the cholesterol lines up in these blood vessels, and they become the source of blockage, and that leads to, again, the cardiovascular diseases. So diabetes is the king of diseases, I say that, and hypertension is a silent killer. So these 2 diseases work in parallel to all the 3 reversible conditions like smoking, sedentary habits, and eating. These are the which can be controlled and reversed, whereas the diabetes and hypertension cannot be reversed. They can only be controlled by medicines, and if they are controlled adequately from the beginning, then they don't affect the heart muscles as such. But if they are not taken care of in the beginning to end, then they may land up.
All right, on a day like this, World Heart Day, how best can we commemorate today?
Well, I only say that this silent pandemic has got only one solution. One ideal solution is prevention. If you can prevent the cardiovascular diseases, that is the best solution. The second best is early detection. Early detection, I mean, all these prevention, early detection, and the treatment later part, it constitutes the first important thing is awareness. And if I can make the public aware of what is good and what is not good at every level of life, that is childhood and school age, youngsters and adults and even old people, if they know what is good and what is not good and what makes them happy and healthy heart and healthy life, that is the one thing. So the awareness comes from the multiple organizations can help into form a part into it. That is government organizations, non-governmental organizations, media and the academic institutions, and to that extent individual families can contribute this awareness programs and multiple slogans and multiple programs on the TV shows like this can make the people understand that this is good, this is not good. So that awareness is there. Once awareness is there, then they can commit to frequent checkups. As the age is increasing after 30, 35, 40 years of age, if you go for a frequent checkups for your cholesterol levels, your blood pressure levels, your sugar levels, then you understand that these diseases can check them in the very early stages, especially when there is a family history of diabetes and hypertension.
Okay.
It is ideal to get these checks done frequently, at least once in a year or once in 2 years, in the beginning and later every 6 months.
Well, let's talk about exercise. You mentioned it earlier on, but I think when it comes to the issue of the heart, where the heart has to pump and remain healthy, apart from diet, a lot of doctors like you have talked about the issue of the need for exercise. Now, there are perspectives to exercise, because when you mention exercise, some people think that going to the gym where you're raising metals and then you have muscles all over the place is what the exercise is. But break it down. What can constitute healthy exercise for anybody that should be involved?
I'd love to answer this question because my patients always ask me this question every time. I say whatever you do with your legs is exercise, and whatever you do with hands or upper limbs is not constitutes the health of the heart. So your weightlifting and other things you do with your hands and arms, it will build up your muscles and the upper body. But the legs which you do, like the cycling, jogging, swimming and running, all these exercises except kicking. So all the other things will make you, the legs will support the heart, and they becomes a second pump of the heart. We say the second pump to the heart in the body is the leg muscles. So if you can do them regularly, the heart is always stays healthy and all. The second is that you said going to a gym. Going to a gym is not possible to everybody. Even the rich man also cannot go to gym. And to have a gym in the nearby, in the building complex or within the house is not possible for everybody. I say that even if you do walking for 10 minutes a time, even from one room to other room, if you walk and are standing jogging, on the spots you can do jogging, you can do walking, and if you do 10 minutes in increments, like you can do 10 minutes 5 times a day, 6 times a day, and it need not be in the morning, or it cannot be need not be in the evening, it can be any time of the day. If you do that 5 minutes or 10 minutes at your own pace, and when you are watching a TV or when you are doing, don't sit and watch the TV. See any program, talk to people when you are in the house while walking. So that walking constitutes the best exercise. Jogging and walking, whichever you do with your leg muscles, is the ideal exercise.
So we should keep the legs busy.
Always.
Now, how about yoga? People talk about yoga as an exercise.
Actually, this is another thing I wanted. I'm coming from India. So
exactly. I'd like you to talk about that.
Yoga and meditation have got multiple advantages. One is that it teaches you how to relax. It teaches you how to keep your mind and body in one direction, and that makes it one single purpose, that your heart relaxes at that time, and the relaxation is very important for the heart muscles. The second is the yoga will make your body supple and flexible, and so that some asanas are there, so that when you are doing it with the deep breathing exercises, it will improve your muscles, joints and lungs all put together, including the heart and circulation system in one order. And when you are doing it, you are doing in a peace of mind, and you are doing at home, and that will constitute a peace in the brain. You are mentally clear from all the tensions and other things, which always, actually it itself is sometimes cure for the high blood pressure in the beginning stages.
So yoga is a form of exercise.
Yeah, it's a form of exercise and relaxation. Relax. People commit to yoga, they cannot leave yoga for any reason. They continue to do yoga.
I see, that's interesting. Now, how about sleep? Sleep is, in fact, for instance, in Lagos, where life starts, in fact, in places that this is a 24-hour, everyone is just working, but the time to sleep as early as 3:30, as early as 4 o'clock in the morning, life has started for some people. And then life goes on until sometimes 10 p.m., 11 p.m. in the night, and then they're still going to wake up at 3, and 4 and all of that. How vulnerable are people who work like that?
You must have heard many times. So sleep is, many people, either early morning they get heart attacks. You know why? Because the sleep constitutes the maximum for the body physiology to restore their normalcy in the sleep hours. If it is not given to the body, then they're likely to develop the problems like high blood pressure and arrhythmias and heart attacks and strokes and other things which happen. The sleep is one important constituent for the body health, and I say that the sleep doesn't mean that number of hours sleeping. It is the peaceful sleeping is more important. And as a child, if you know, an infant when he is born, he sleeps for 18 hours. As the child sleeps for 12 hours and all. As the adult grows, sleeps to 6 to 8 hours. As the old man, he sleeps only 4 to 6 hours. He cannot sleep more than that. So the sleep hours comes down, but it doesn't mean that they should not sleep in whenever it is possible. The idea is that whenever you have time, you specify your timings for the sleep, and because sleep itself cures many conditions, and sleep should not be neglected, and always fix to one pattern of sleep. Sleep, certain habits in the body are habitual. Once you fix to one habit, it remains it. And sleep makes the entire system to service all the system. All the organs get serviced.
Great. Thank you very much, Dr. Jagan Hanumanthu, for coming on the program. Thank you for enlightening us. And I will look for a way of starting my yoga classes soon.
Oh, great. That is another thing I want to tell, that we should always pass our knowledge, our experience to our colleagues wherever we are working. So that makes it more and more people will form the same group.
Okay. Thank you so much.
Thank you very much. It's my pleasure.
Right. Thank you.